Good evening. Room rounds with Dr. Soloway, or Soloway Speaks TV, or whatever you'd like to call it. Anyway, right now we have a topic that just came up. And first, let me give a shout to my buddies at the Vineland Police Department. Without my buddies at the Vineland Police Department, I would not have this topic to talk about. So, special shout to Jeremiah and Steve. Okay, so we're going to talk about a stiff knee. So, many causes of a stiff knee. 1, trauma. 2, no trauma. So, everybody can imagine if you walk down the street and twist your ankle, you might twist your knee. You might imagine if your foot gets stuck in a ski boot and you try to move, you might twist your knee. Excuse me, it's this, I think the air with the pollen or something. I don't know, something's getting to me. So, trauma is one thing. If you get trauma, you can damage the joint. You can get a fracture of the joint. You can get a dislocated piece of bone from the joint. You can tear the cartilage, either medial or lateral meniscus. You can dislocate the kneecap or the patella. You can, excuse me, you can tear a ligament such as the ACL or the, that's the anterior cruciate ligament. That's the one that allows for motion back and forth, the lower leg on the upper leg and vice versa with the ACL and the PCL. You can have collateral ligaments. So the collateral ligaments are essentially there so that you don't need a steel knee brace. They keep the leg straight. Now on the non-inflammatory side, you can have swelling of the knee for no reason whatsoever. And the most common thing that we usually see for a knee to swell up for no reason whatsoever in a younger population would often be something infiltrating the cartilage, such as iron or calcium. So the more common is calcium pyrophosphate. So if your cartilage is infiltrated with calcium pyrophosphate, you can get an attack of pain, swelling, redness, warmth. And if calcium, in fact, is the culprit, this would be referred to as pseudo, or looks like, gout. So sort of looks like gout or pseudo gout. And the reason it's not gout, which it could be, is that's because gout is when uric acid crystals get in the knee and the body recognizes those crystals as foreign and incites a reaction, a cascade that leads to inflammation, swelling, tenderness, warmth, redness, etc. What else can happen to somebody? Well, a person could be taking medications. We'll use an example to be prednisone. If you take too much prednisone, say 60 milligrams a day for a year, you're going to wear out the bone in the knee, and you could have a microfracture. You can have a small dead piece of bone called avascular necrosis. Excuse me. These are causes of knee pain without you injuring your knee. Everything I've said about the knee can also occur in the hip or the ankle, albeit not as common as the knee. So, what are the treatments? Well, typically the treatment is get a good history, and then do a good physical exam, and then do an x-ray. And feel for tightness, swelling, lumps, bumps, instability, and also feel and look for inflammation or signs of inflammation. So if there's fluid in the knee, we drain the fluid out, we analyze the fluid. If we see lipid in the fluid, we can actually diagnose the fracture before the x-ray is ever taken. If we see crystals such as calcium or uric acid, then we know our diagnosis of pseudogout or gout. If the fluid is bloody, then we know something was torn. Or, of course, you could be on a blood thinner. So, again, as I sometimes say in these little short stories here, this lecture or this conversation I'm having with you is not encyclopedic. It's not meant to be. It's meant to be provocative, stimulate your mind, get you to ask questions, think about other topics, drop me a line so I can answer some more. Anyway, hope you have a great night, and look forward to seeing you again soon. Take care from Room Rounds, Soloway Speaks.